Respiratory viruses like coronaviruses or influenza, they can circumnavigate the globe very, very quickly. You don't have time to identify a new virus and then start working on a solution. We are seeing very, very concretely how what happens when you don't invest enough in your healthcare systems and in pandemic preparedness. There is no better example of convergent science than what's happening right now amidst COVID. This is a phenomenal experience of a large group project that's happening across the globe right now. This is a powerful moment to capture. Everyone is figuring out what they can take from their research and bring to the table. And it's been pretty remarkable. I mean, we're seeing all sorts of newcomers into this battle. There's an incredible value with that sort of collaborative, synergistic science. Pandemics are something that affect every aspect of our lives, and we need the best of the best, from engineers to clinicians to physicists and mathematicians, computer scientists, architects, and beyond. It is an extraordinary area where we can think through these things cooperatively, collaboratively. We have the capability to develop vaccines or create better diagnostics. We just need the resources, support, effort to line them up and to put all those pieces in place. And we're seeing that happen now. If we continued on with this level of, or even half this level of global engagement, that we could actually create a global system to be better prepared against pandemics. There's just a lot more research and funding that needs to be put towards understanding the biology of our interaction between viruses and understanding the viruses themselves in order to really get to the point where we can develop vaccines. You do need to create platform technologies that you could, whatever new virus is circulating, be positioned to target it immediately. There's no reason why we shouldn't have programs to try to target everything that could be likely a pandemic. Anything that we do to advance study of one virus, either for preemption or response, will help in those things for other viruses. We need to incentivize good action and give recognition for early sharing or thoughtful sharing or collaboration. Companies need to be incentivized for preparedness, not just for response. Even in academia, I am always thinking about incentive structures. Ultimately, you have to realize that science needs to work a little bit differently when you're dealing with a pandemic or even the threat of a pandemic, and to recognize contribution, meaningful contribution in whatever form that takes. Everyone now is paying attention and recognizes that any effort they can put towards helping stop viruses and stopping pandemics is good for the entire global community. If that can sustain itself even to some degree, we are really in good position to be able to protect the planet from pandemics in the future.